Hi, I'm Karen Howard, Advocacy Manager at MHA, and thank you for joining today's National Policy Institute. It's a pleasure to welcome you to our program on prevention and early intervention, and we appreciate all of those who made today's event possible, including our sponsor, Kaiser Permanente. We're coming to you live from our headquarters in Alexandria, Virginia, and are broadcasting worldwide. To join the conversation online, please follow us on Facebook, Twitter, Instagram, and use the hashtags MHA Policy 2020 and before stage 4, using the number 4. I'm especially excited about today's program because it is personally meaningful as someone who experienced early childhood trauma and needed some support in high school, but did not get the help I needed until college. I also saw other peers who would have benefited from mental health services and other supports in school, but were instead directed towards the justice system. In fact, nearly 10 years is the average time between when people first experience symptoms of a mental health condition and when they get treatment. That is why we need programs like today's, so that we advance policy solutions to facilitate early intervention in childhood. And why not meet students where they are, in schools and communities? Now I'd like to turn it over to Dr. Don Mordecai, National Leader for Mental Health and Wellness at Kaiser Permanente, who spent decades dedicated to the advancement of policy changes to help people with suicidality and mental health and substance use disorders. He will be followed by Congressman Katko of New York, one of our great legislative champions, who very early in his first term took the lead on suicide prevention legislation.
Greetings. I'm Dr. Don Mordecai, National Leader for Mental Health and Wellness for Kaiser Permanente, and I want to welcome you to Mental Health America's 2020 Policy Institute. As we all manage through a global pandemic, we see the second crisis in the making, a crisis of mental health, addiction, and deaths of despair. Today's virtual event will explore how to better meet the needs of underserved youth and young adults, including those who identify as Black, Indigenous, people of color, and LGBTQ+, women during the perinatal period, and how to address healthcare payment and workforce issues. Communities of color have been bearing the brunt of COVID-19 since the pandemic began, and as multiple states across the country are seeing record-breaking spikes in cases, doctors are seeing young people of color with underlying medical conditions being hit harder by the virus than their peers. In fact, across the United States, we're seeing alarming statistics about the disproportionate toll of COVID-19 on people of color. Hispanic and Black children are much more likely to require hospitalization for COVID-19, with Hispanic children about 8 times as likely as white children to be hospitalized, while Black children are about 5 times as likely. In the city of Chicago and the state of Louisiana, Black patients account for 70% of coronavirus deaths, even though they make up roughly only a third of the population. In San Francisco, Latinx account for 15% of the population, but 25% of confirmed COVID-19 cases. These statistics alone are a clear sign that we should be concerned about the potential long-term effects this pandemic will have on children and families, especially families of color, many of whom will experience this pandemic as a long-term trauma. And this collective trauma will be reflected in the mental health of our nation. According to recent research released by the Wellbeing Trust and the Robert Graham Center, as many as 75,000 more people could die from drug or alcohol misuse and suicide as a result of the COVID-19 pandemic. The American healthcare system has historically been under-resourced for mental health, including shortages in mental health professionals, and mental health care needs have not been addressed with the same urgency as physical health care needs. However, we do see the opportunity to develop policy shifts that can help us begin to meet the great need of the second crisis. Kaiser Permanente, along with many of our partners and like-minded organizations, are working to advance mental health care for everyone, not only through the work we're doing to improve care right now, but also by building a model for mental health care based on evidence of what works, measurable outcomes, integration of emerging technologies, and breaking barriers caused by stigma. Today, we have convened experts and visionary leaders to explore the long-term effects associated with COVID-19 on youth mental health and how we can support the mental health of our youth today. The goals of today's program include sharing what we've learned about the mental health impacts of COVID-19 on youth, especially in underserved populations, lifting up current programs and initiatives that focus on early and upstream interventions, highlighting promising policy solutions, identifying opportunities for cross-sector collaboration. And now I have the pleasure of introducing Congressman John Katko, who represents New York's 24th District in the United States House of Representatives. In Congress, he serves as a member of the House Homeland Security Committee, as chair of the Transportation Security Subcommittee. He also serves on the House Committee on Transportation and Infrastructure. In 2019, Representative Katko announced $2.5 million in federal funding to address the shortage of mental health professionals in schools. Over a 5-year period, this funding is bolstering on-site mental health services with an emphasis on prevention. The American Psychological Association praised Representative Katko for introducing critically needed legislation to help expand access to mental health services for the 115.4 million Americans living in geographical areas without adequate access to mental health care. Please join me in welcoming someone who is creating positive change for mental health care access in the communities he serves and across our country, Congressman John Katko.
Hello, this is Congressman John Katko. I want to thank Mental Health America for allowing me to provide opening remarks for today's event on investing in mental health prevention and early intervention services for young people. Such a critical topic. As co-chair of the Bipartisan Congressional Mental Health Caucus, I work with Republicans and Democrats daily to improve access to quality mental health care and reduce the stigma associated with seeking treatment. The current public health crisis has greatly underscored the need to advance these efforts. During the pandemic, many individuals, and especially young people, are struggling to deal with the emotional toll of increased economic uncertainty and added precautions that keep people at home. According to data from Mental Health America, over 250,000 people screened have suffered from symptoms of anxiety or depression during the pandemic. Additionally, over 42,000 people screened were positive for psychosis, with another 90,000 people experiencing thoughts of suicide or self-harm. That is terrible statistics. In addressing the public health threat posed by COVID-19, we must address the clear toll it has taken on our nation's mental health. To do this, we need to build on our efforts to expand access to telehealth, increase outreach and screening, and provide funding for mental health professionals on the front lines. I've been proud to lead efforts in Congress to provide immediate funding to mental health providers that are struggling to meet increased patient volumes while facing significant budget shortfalls. Still, more must be done, especially for students who are gearing up to return to school this fall. With new precautions in place and changing classroom dynamics, many are expecting there to be an increased need for mental health resources for students. We must act now to address the significant gaps in pediatric mental health care, which prevent students from accessing the treatment they need. That's why I'm continuing to push for my passage of my bill, the Mental Health Services for Students Act. This bipartisan legislation, which I authored and introduced with my friend and colleague, Congressman Napolitano, would fund on-site mental health services for youths in schools nationwide. I strongly believe early intervention and prevention in mental health programming is what's vital to building better futures for the many children and families whose lives are impacted by mental illness. In the coming days, I will continue fighting for bipartisan policies that increase mental illness prevention and early intervention, particularly among our youth. Thanks again to the Mental Health America for putting this forum on and allowing me to be a part of it. It's a high honor indeed. For everyone participating, I'd like to remind you, while we are all reckoning with new and unique challenges, it is important to remember that together we can and will get through this. And I will say that you are all on the front lines, and what you do every day is unbelievable. You're the angels of our society, and I want to thank you for fighting the good fight and continuing to do so. May God give you strength and give you the ability to get through these tough times and help so many people that need your help. Thank you.
Thank you, Representative Katko, for all of your tremendous work. It is now my pleasure to introduce MHA's President and CEO, Paul Gionfriddo, who's a great statesman and advocate for his son, Tim, and for everyone with mental health conditions. As policymakers consider additional changes to meet the country's needs during the pandemic, Paul makes the case that mental health care must be treated as part of our overall healthcare system, and based on MHA screening data that these investments are urgently needed to address increases in anxiety, depression, psychosis, and suicidality, especially for people who are Black, Indigenous, or other races. Paul?
Hi, everybody. Welcome to our 2020 Policy Institute. I'm sorry we're not able to do it in person this year, but it's good that we're able to get together, and I'm so glad that so many of you have decided to participate with us today. You know, for us, this is the first of 4 days this week at Mental Health America that we're going to be doing a number of things, but to me, the work that we're doing today is really essential as we lead into our annual conference week here. And that's because so much really is dependent on policy. And while we'll be focusing today specifically on early identification and intervention, and specifically on what's happening to our children and what we can do for our children, the reality is that this entire world in which we're living right now, this entire world of mental health services and supports in particular, is heavily influenced by the policy decisions that our leaders make. And those decisions will be heavily influenced by the information we provide to them, both in terms of data, in terms of stories, and in terms generally of the recommendations that we can make that they should carry forward, moving forward. Now, when the pandemic hit about 6 months ago, we made a decision to take our online mental health screening program. It's been in operation since 2014, and to use it to do real-time monitoring of the impact of the pandemic on the mental health of the population. And so starting in March, we began to provide information about what screeners we were seeing and what screening tools they were using. At first, we saw anxiety numbers going up. Later on, we saw depression screening numbers going up. Still later on, we began to see our psychosis screening numbers going up. And we wanted to understand what that all meant and what we could do about it. Well, you can't understand what it all meant until you think about how truly dramatic this particular wave of the pandemic has been. As of July, from March, we have seen in excess of more than 250,000 people screening positive or moderate to severe for either anxiety or depression since the start of the pandemic. That's 250,000 more people who would have screened positive before the start of the pandemic by using the baselines that we had from November to January. It's really an extraordinary number when you think about it. And one of the equally extraordinary and scary numbers that we've seen are the 90,000 people who, in taking that depression screen, have told us that they have thoughts of suicide or self-harm on more than half the days of the week. 90,000 people, 30,000 in July alone. To put that in some context, we were seeing about 4,000 people a month who had those kinds of thoughts in January and in February. And to see that number, which was very similar to the kinds of suicidal experiences we've had with losing 45,000 to 50,000 people every year from suicide as a baseline, to see that number increase so dramatically really causes us to worry. So we've looked at those data and looked at who, for example, is feeling the deepest effects of this pandemic. And we found two populations in particular that really give us a lot of concern. In the Black population, for example, we're seeing more frequent suicidal and self-harm thinking than we're seeing in any other population. Not that Blacks are necessarily experiencing depression more frequently, they're just experiencing that particular aspect of it more frequently. And it's young people, the 11 to 17-year-olds, who are really feeling the effects of this pandemic the greatest. While 1/3 of people in my age group report suicidal or self-harm thinking on more than half the days of the week, it's more than half of the young people who screen for depression. And it's 90% of the young people screening for depression who screen at positive, moderate to severe for depression when they take that screen. So we have to do something about this. There are things we can do at Mental Health America programmatically by ourselves, and there are things we can do programmatically in association with partners and others. But really, if we're going to make changes, they have to be at the policy level, because it's policy that's influencing thinking these days. It's not the ideas and thinking of people that's influencing policy so much. So we have to use the policy levers we have to improve early identification of kids, to understand as they return to school that we need to be providing mental health services to each and every one of them. We need to improve our special education services for those who are in serious need of emotional and mental health support. We need to make certain that we have provided adequate resources and funding across communities through behavioral health block grants at the federal level to make sure that we paid for all the services people need, even when they are at the earliest stages of experiencing serious mental health conditions. And we need to make sure that we're doing this work systematically, that we're doing it throughout the nation, and that we're doing it effectively by learning from those people who have piloted prevention strategies and early identification strategies, who have piloted educational strategies to improve circumstances there for people who have been doing the good work and now can set examples for the rest of us of how to continue to do this good work. So I hope you're looking forward to the remainder of the day. I know I am. And I hope you're looking forward to the opportunities we're going to have to hear from true experts throughout the course of the day in all of these areas of prevention and early identification, with particular emphasis on kids and kids of color that we'll be talking about. Enjoy the rest of the day.
Thank you, Paul. I'd like to welcome Dr. Art McCoy, a dynamic speaker and advocate who serves as superintendent of Jennings School District in Missouri. He's a nationally recognized leader in meeting the needs of the emotional and social needs of children, especially those who have experienced trauma. And he works with community partners to ensure an appropriate school response, not a law enforcement response to children with emotional needs. Dr. McCoy is taking questions immediately after his presentation. Please submit your questions for Dr. McCoy as they come to mind during his talk.
Greetings, I'm Dr. Art McCoy, Superintendent of Jennings School District, and it is a pleasure to present to you today on education innovations with a mental health framework and equity framework. So it's all about equity, and especially during COVID, when schools have so many unique challenges that we currently face in our communities, in our schools, and beyond. I want to dig in for the next 25 minutes with you on innovative education strategies to address these challenges. So let me start by sharing some student voice and sharing my screen. This poem and the next poem were both written and shared and expressed by students, countless students. First one is about hard times. Grandma just died. There's no other family nearby. Feeling like Godzilla's pride because every 2 hours, one of us aspires from an act of violence. And during COVID, every 7 minutes, someone aspires. So all I do is hide. Feeling empty inside. There's no understanding of these hard times. It doesn't even help to get high. Go to school? Can't. Go to church? Why? Don't deny that even if I could, it wouldn't help. There's too much pain, too much pride. Call it fate, but hate helped me just get by. But to my surprise, a new feeling has visited my mind. When all alone late at night, it seems justified. It's a suffocating feeling inside, and it says, I'm your savior. God? No. Suicide? Yes, suicide. Now, knowing that over 73% of African-American males feel suicide tendencies now over the past 25 years, and now becoming the first group, the highest group to perform suicides or have suicides. That is poignant for millions of people, not just Black males, but white males, females, and many more. We have to advocate and help all of our children and youth. The second expression is, who can I turn to? I'm a person lost in the world. I don't know where to turn. I'm a girl wanting to achieve at everything I do. I just want to be treated like I exist. I want to be seen, for more than the person outside of me and the outside of me, but I want to be seen for the person inside of me. But I feel like I'm all alone in the world. I feel like there's no one or nowhere to turn to when I feel like it's the end of me. Sometimes I want to run away to a place where no one can hurt me or abuse me. Sometimes life for me will never go right. As much as I try, it just never will go right. So what should I do if the problems I face won't come up from this deep, dark place inside of me? Who can I turn to if I can't turn to the person who gave life to me? Who can I turn to? The answer has to be me and you, everybody. And those answers of me and you were the answers before COVID, which I call BC, and it's the answers are during COVID, which I call DC, and it's going to be the answers after COVID, AC. Our life changed after March of 2020 or around March. And we're going to be in this situation for some time until there's a vaccine, a cure that works and is trusted and free, or until there's herd immunity or a combination of both. So what do? We have to focus on Maslow's hierarchy before Bloom's taxonomy as education institutions. As a school system, I'm proud to tout that we've had 4 years of 100% graduation rates, career and college placement rates, with students getting jobs, paying living wages of $20 an hour in an area that has 98% African-American population and 1% Hispanic and 100% free reduced lunch. A promise zone to the best degree, but we don't let our zip code define us. We have 2 homeless shelters, 2 grocery stores that we own and operate, 2 school-based health clinics that give all medical needs from dental, mental, and small surgeries, and much more. But it's a focus on the wraparound services that makes a difference. Focusing on Maslow's hierarchy being the psychological, the physiological needs, sleep, rest, so forth, water, food, safety needs, a roof over your head, physical security, and then love and belonging. That leads to self-esteem. All of that's before you get to Bloom's taxonomy, which is a theory of learning, understanding knowledge, comprehending things, analyzing things, and ultimately synthesizing and making judgments through evaluation. That's important, but Maslow's before Bloom. So we're proud to know that that has been a success in our district, and it's now even more important. These are health-based school clinics that you see at the elementary, middle school level. These are our homeless shelters that you see, rooms that we shelter over 50 kids. I love that we have comfort spaces in every school. 2 of them, one for adults and one for children, because we must be centers for healing engagement. Ultimately, we have gardens at every school. Miss Leslie McSpadden and my board members helped to make sure that it just didn't end with the tragic death of Mike Brown, her son, but we created new vegetables and fruits, working with organizations like the St. Louis County Police Department and more. Students deliver food and groceries. They have a sense of belonging and adult champions. That's the last C. It's computers, connectivity, and every child deserves a champion and a life coach. I'm so proud of our students for having that and for becoming workers, wonder kinds. But it ultimately takes a focus, and that focus includes shifting from me, myself, and I, which is often a great contribution to the illness that goes on, the isolation, to a concept of we for wellness. If you change that one letter of I to the we, you have illness changing to wellness. And we are proud to be we schools where all of our students do service learning as seen on the screen. But we're proud to have we teachers in partnership with the Mental Health America so that teachers are trained on mental health, on trauma, and they get a grounding and understanding of how to build resilience. And it's a natural part of our required professional development and for our teachers to help other adults, parents, and more. During COVID, DC, this is so essential because we saw that over 33% of our children across the nation, based off of the data, have become worried. They have trauma and anxiety just related to COVID. 17% are afraid to even go outside. Young children, ages 5 and 4 and 3, hide in their rooms and hide their faces. Learning is twice as long because of the isolation and the disengagement. The cognitive processes are reducing. So that's the data. But what do you do to change this structurally, systematically, policy-oriented? Well, of seat time for credit. If you can't sit in the seat in school, there's no seat time anymore. You have to change to 24-hour learning, to asynchronistic learning and synchronistic learning, virtual learning environments, making school centers for healing engagement, community centers, where people can go 6 or 7 days a week to get anything from food to mental health to a life coach to a person who will help heal them. I'm proud to know that we were one of the only schools, we were the only school in St. Louis County and City in a high zip code for COVID that opened our schools for those who were facing neglect, for court adjudicated kids, for students who were homeless, because we have 2 homeless shelters, for those who had disabilities. We said we will become contact tracers, and we have a quarter of our staff as contact tracers. We're the first to write the plan, get it approved, and have in-person summer school in June, July. Because we understand, because of those efforts and more, and from our parent-child interaction therapy, the only in the state of Missouri and 1 of 4 throughout the nation, that the way your synapses are accumulated in the earliest years, that's called synaptivity density, it can be a permanent thing if you don't have resilience training and skill training early on to understand how a parent should interact with a child who may be facing cognitive difficulties with their executive lobe functions, their executive functions in their frontal lobe cortex. So we've engaged our top neediest 100 families to have EEGs placed on them to see their amygdala light up versus your critical thinking frontal lobe light up when you've been given the appropriate mental health and resiliency skills and therapeutic training to understand focus, perception making and taking, communication. And both the child and the student grow and their life is forever changed. These activities must become a part of our policies and procedures across the nation in order for us to truly survive during COVID and thrive after COVID, AC. We have focused every school on having social, emotional learning curricula and professional development that focuses on self-management, self-awareness, responsibilities of decision-making, and your relationships. That's why Maslow's comes before Bloom's. These are the core components that every kindergartner and even preschooler should start with learning through play, learning social interaction with an awareness of yourself. Also understanding biofeedback and what your body is saying. If you become nervous, anxious, want to hide, if your heart rate increases and so forth. Or if you see protest in the street, that you have the power through adults to actually lead a student march against police brutality like our students did. March through the streets, let your voice be heard. Because ultimately, every policy in every place should be a center for healing engagement by saying, I see you, young people. I see you, young adult. I support you in your wellness, your well-being. You are sufficient. And if you aren't sufficient, then we are sufficiently able to be more today than we were yesterday. Those are the strategies. But ultimately, 7 key recommendations are essential. And they're taken from the premise of some very key work, because we can't settle for small change. After you've had over 1 million feet in the streets protesting after the death of George Floyd, we can't settle for small change. We need big bills in Congress, but bills in dollars, funding. I love the policy and totally support the statements of the Mental Health America organization, but the policy and actual bill 5469, Pursuing Equity in Mental Health Act, it definitely supports these changes. We must first become adaptive and understand that we have to change our assumptions, change our attitudes, our behaviors, our beliefs, and our culture and climate. Those are the ABCs to the policies that must be written. It has to deal with an attitude towards screening and having identification of who needs things the most, very intentional to the places in need, focusing on the heart, head, and hand. It has to be evidence-based work that works. It requires PD and training. That's why I'm so glad that over 5 years ago, after Mike Brown's death and with working with the police department, we signed an MOU that said you will not marginalize nor victimize our students, police. You're here to protect and serve. No arrest shall occur without the permission of the building principal in any school property. You will be trained in cultural competency. You will be trained in trauma-informed practices. You will become a center for healing engagement as volunteers in the streets and in our basketball courts and everywhere else, in our gardens, to volunteer to help show that a student can become a cop like you. You should not get involved in anything that's not physical or not illegal unless you're being a positive life coach. That's professional development training for all adults, not just the teachers, but also the partners that work with you, like police officers and MOUs and memorandums supported by the ACLU with much data and more ways to help it matter and happen in communities that need it most. Number 5, focusing on Maslow's hierarchy over Bloom's taxonomy is so essential. That means that when you do get to instruction, it has to be relevant to the person's life. But you have to first say that I care about you. So you have to show that you have heart, which is what Maslow's hierarchy needs says. Do you see me? Do you have a heart to help empower me? And now that I know that you care, now I care about what you know and what you want me to know. Focus on students first in education institutions. That means look for those with high needs. Make it a positive environment with positive engagement. That's what healing engagement is all about. Restoration, restorative justice, empowerment, making sure that you hear the voices of the youth as we started this presentation with. And lastly, making sure that it's a safe environment for learning and a safe environment for all. There's secondary trauma that's very real. And so how do you put that in place? Create safety when people overwhelmed, very nervous, have biofeedback and understand what their body's saying. Make sure there's connections and relationships. Understand that you have to have support and professional development. It has to be coherent, intentional, and a part of what you do, the development. Focus on power skills. How do you disseminate power and empower people to have more power over their own reality, their own thoughts, their own reality, their own actions, their own culture? Resiliency is a huge piece of this because we can do anything. If we shift that I that often is at the front of any illness to a we together, then we have the power, we have the resilience. We can put resilience back into the hearts of people who feel hopeless, just like those who may be facing suicidal thoughts, and then continue to foster post-traumatic growth. That means it's okay not being okay. It's okay to road test your feelings and emotions. We need policy and make a normal part of what we do. It's okay to self-soothe. We must get active. We must celebrate resilience because it's there, and we must seek community. Not just seek it, but establish it, create it, so that no one feels like an imposter, not in their own home, not in their own school, not in their own neighborhood or community. We must seek and create the community that we deserve. So I'll close with saying that we have everything that we need to succeed. We are our current solutions that we've been waiting for. And now it's time to just get to work with intentionality, knowing that we need no more small change. It's time for some big bills and big action to make it a better day. Thank you for your time. I look forward to some questions and answers.
Thank you so much for your remarks, Dr. McCoy. Welcome. We're glad to have you here for question and answer. I was speaking with a restorative justice advocate for the Montgomery County school system in Maryland. And she recommends some very similar things that you mentioned today, that as students return to school, policies should be put in place to ensure that it's not a business as usual environment, ignoring kind of the current events and kind of the environment that students are in right now, and that there should be a continuum of restorative practices, not unlike your healing centers that you mentioned. Can you talk a little bit more about how you worked with the community to install these centers and ensure that students feel they have a safe space at your schools?
Sure. First, it's great to see you, Ms. Howard, and it's always a pleasure to be with your organization. So first, I'll share, students are lie detectors. They know when an adult is pulling wool over their eyes, And the last thing you want to do is to act like COVID doesn't exist or like nothing's changed, because the truth and reality shows the opposite. You will lose credibility the moment you do that as an adult or as a system. So what you have to do is work with organizations to lean into the discomfortable things, lean into the truth of the matter, get feedback constantly from your population, do a needs assessment that's either like direct on the street, asking the person, how can I help you? What do you need? Or that's also by paper, pencil. Begin to set up places that become feedback loops for homes, for community centers, for even your schools, even if they're closed. Create feedback loops. But ultimately, you're stronger together. So there are partners that are already engaged in wellness, in trauma-informed practices, in safety, in wellness, in gardening, and so forth. So look for those partners and don't reinvent the wheel. Begin to give them some space in your place. And so bottom line is, to becoming a center for healing engagement or for restoring justice is to, if you have power, to look for some space in your place or some space in your policy and procedures so that you fit in those solutions, and you ultimately are empowering the people that already exist, that have organizations. You're enlightening the community to what's available, and you're engaging everyone to work together. Those are the three key strategies: empowering those powerful practices and scientifically proven practices and places, and then engaging and enlightening individuals that they're there to take part of it.
Thank you. It sounds like you're an expert on working with community agencies. Since your students have a 100% graduation rate, they're graduating with trade school jobs or tech jobs or going to college. Can you tell us, though, about particular policy changes that need to happen still, because Black and Indigenous and other youth of color are being left behind with the current system?
Yes, definitely. Yes, a few things. One is competency-based learning policies. Some states still don't allow competency-based learning. What does that mean? That means that if a student is already competent in algebra, they need to be able to take the exam, the final exam for that whole course in the first week, first day of school, first week after reviewing some. And if they make a 70%, they get a pass. If they make an 80%, a B. If they make a 90%, an A. That allows you to accelerate that child into the next grade or the next class based off of their competency immediately without seat time. So that's one policy. The second thing is that our school systems are paid by taxpayer dollars. So it should make, the public schools are at least, and even the private ones have some philanthropic dollars that are businesses and corporations. So the systems and the policies should allow for CTE, career technical education, that allows for your junior and senior year to include learning and earning. So basically a year or half a year should be built in for actual learning trade skills, but not just that, power skills, entrepreneurship skills, so that you can be a producer and not just a consumer, because ultimately jobs equate to mental health. When you have the ability to meet your safety needs, meet your physiological needs, you feel better about yourself. So if you have a living wage and the skill set to earn a living wage, you have better mental health. The data shows it, research shows it. So ultimately policy is needed that implements that as a part of the senior year. That is so essential during COVID, when many people are laid off, millions, and older individuals with experience are taking entry-level jobs, rightfully so, just so that they can exist. Well, we need policies that allow for a safe space for seniors and juniors to be able to practice micro enterprises, entrepreneurship skills, and get paid small stipends for it as a built-in part of their earning and learning in their high school education. So that's what we've done in our incubator, but that's what states can do with statewide education policy, also workforce development policies, federal workforce development policies, and more.
You have a lot of questions coming in and only about a minute left. Can you share what would be your recommendation for other advocates as parents, as community leaders, as direct service providers, as even everyday folks? How can they get involved in ensuring that the school board or the local folks in their community are engaging in a way that is not leaving certain students behind?
That's great. Great question. Hard question with a minute. There's two forms of power. Everything boils down to power. Even racism boils down to power. Sexism, discrimination, behind all of that oppression is power. So you have power. That's what you have to understand. You have influential power and you have some authoritative power, especially if you have a job anywhere. So you look for your circle of influence in your job, and that's your authoritative power. If you're a supervisor or boss, or you come as a representative of the organization, know what your organization stands for and push other people in power to endorse what your organization stands for. That's authoritatively within your organization. But then influentially, you are a citizen, and anybody who's a paid taxpayer, tax-paid leader, so any congressman, any city hall person, any board person, any president, they have an obligation to hear you, to see you, and then to respond to you. And especially if there are thousands of you, then ultimately the deal is to never stay quiet, never shut up, never leave it alone. Always feel empowered to let people know that you all are paid to move at the speed of the need by my taxpayer dollars. So you use your influence to help urge them to move at the speed of the need, and you use your organizational authoritative power to say, yeah, we're going to together move at the speed of the need. Otherwise, there'll be some shifts in your funding and support. So never be ashamed. Live out loud. Now's the time. We need you.
That's excellent. Do you have any last words or remarks? Because I think everyone is really engaged in what you're saying. We're being asked if your slideshow presentation will be available to people after the event. How would you like to close out?
I would just like to close out really organically in saying this. Some people are in survival mode, and some people are trying to be in solution mode, and maybe even narrow-minded as they try to solve one problem. Please advocate for what you see, because tunnel vision will hurt us. So there's a lot of discussion on getting kids more computers. That's great, but there's more C's than computers. Getting them connectivity, broadband, that's great. But none of that means a hill of beans if you don't have life coaches to help you navigate these uncharted waters, and champions that will advocate for change and social justice. So be that life coach, be that champion for kids and for communities. That's my closing remarks to each of you.
Thank you so much, Dr. McCoy. What a dynamic speaker. We really appreciate you taking the time to be here live today, as well as making pre-recorded remarks. Let's definitely keep in touch, and we look forward to working with you in the future.
I look forward to it. Have a great rest of the day and conference.